Welcome to Contemporary Retirement. Contemporary Retirement is a public interest program focused on the retirement community. Every program has segments on legal, financial, and health issues affecting the retirement community. Contemporary Retirement is sponsored in part by a major grant from the Family Heritage Trust Company.
Contemporary Retirement is sponsored by Family Heritage Trust Company. The Family Heritage Trust Company is an independent bank chartered trust company established by local professionals to provide fiduciary services including fee-based investment advice, trust services, retirement planning, and tax planning. The Family Heritage Trust Company is committed to client service in our communities. For more information, call the Family Heritage Trust Company at 301-631-5900.
Contemporary Retirement is sponsored in part by a grant from R. Thomas Murphy & Associates, P.C. R. Thomas Murphy & Associates is one of Franklin County's leading law firms, emphasizing estate, trust, elder law, and medical assistance planning.
Welcome to the Is It Legal feature on Contemporary Retirement. Is It Legal focuses on the legal issues affecting the retirement community. With me today is Tom Murphy from the R. Thomas Murphy Law Firm with offices Waynesboro, Chambersburg, and McConnellsburg. Welcome to the show, Tom.
Good morning, Mike.
Tom, we've been doing a sequence on estate planning versus elder law. And many of the pieces of advice that we give that people just do not like is the fact that trusts are almost always an impediment to medical assistance planning.
Yeah, I think people are surprised to hear that because they get pounded with these people trying to sell them things, you know, and the rubber chicken seminars and stuff, and they're surprised to hear that it's actually going to cause more problems in the long-term care world than fix.
And so oftentimes people have just had it ground into them that you must avoid probate, must avoid probate. Now, several of the pundits who talk about avoiding probate are California-based, which does in fact have the world's most nightmarish probate system. It's just incomprehensibly bad. And it might tilt a little bit toward trying to avoid probate, but even in California, the problem is the same. The tools that you use to avoid probate almost always interfere with qualifying for nursing home benefits. And you got to look at that expense of probate versus the cost of a nursing home. And the nursing home just dwarfs the cost of probate.
Yeah, in Pennsylvania and Maryland, the process is very simple. And so, yeah, I wouldn't personally do anything with a trust just to avoid probate because it is such a simple process.
So you have a married family, they put their house in that trust, they put their family business in that trust. They've taken assets which were exempt, and because they put them in a trust, now they're available resources, and we got a problem.
Right, and it all comes back down to how difficult is it going to be to get those assets out of the trust, because some of those trusts that are written in such a generic, countrywide way have these poison pills and bad language which make it very difficult or impossible to get assets out.
But then people go, yeah, but I avoided probate. And I said, well, you know, first of all, you're totally fixated on the wrong expense. But let's assume for a moment that's true. So we get the horror story. People say, well, my estate was open 3 years and it was the attorney's fault. Now, in most instances, whose fault was it?
Well, it's almost always the family's fault. Simply, you know, kids and fighting, executors not doing their job, because the process is pretty simple. And so it's never the process's fault.
You know, Tom, I'm going to take it one step further. 99% of the estates that I have that have been open for 3 years have been open for one reason. It was not fighting. It was the kids' inability to get off their duffs and deal with that family residence.
Oh, exactly. You know, everybody's afraid of cleaning out the residence. It's a
well, they
major
look at that thing and say 80 years worth of accumulation, I think I'll go on vacation.
Yeah, exactly.
And they keep kicking the can down the road.
Right.
And what they don't realize is that it wouldn't have mattered whether it was in probate or not. If it was in a revocable trust, that house would have still been sitting there for 3 years unresolved.
That's a good point. It has nothing to do with the process. It's about the operator error.
And so most of the time when I see lengthy probate processes, it is always the failure of the family to address the assets that were there. And how it was titled, whether it was in a trust or it was in probate, was not going to make any difference.
Exactly. That is never the issue. And so you shouldn't be afraid of the issue or buy into some, you know, scary words about probate.
Well, they're telling stories, but they're not dealing with what the real reality of it is. And frankly, in Maryland, if I really think I have some procrastinating children, In probate, I can actually speed up the process, because one of these days the orphans court's going to tell them, get off your duff and deal with this house.
Yeah.
Whereas if it's in the trust, nobody ever does that.
Yeah, exactly. And that's part of the pros and cons too, because sometimes the trust is offensive to the beneficiaries to a degree, and shields a bad trustee. And so you got to look at that side.
Yeah, there's no supervision in a trust without very expensive legal proceedings, whereas in probate there is very direct supervision by the court. It's easy to access that court, and sometimes it's a better way of controlling the process. Now, we will do trusts in instances where we have multi-state real estate. You know, a person has a house in Florida plus a house in Maryland. Doesn't necessarily mean the Maryland property needs to be in that trust, but we might use a trust to hold the Florida property to avoid having to do probate in Florida as well.
Exactly. Yeah, people shouldn't get the impression that we hate trusts. We think they're a great thing. We're members of a trust company board. I mean, but it's not the appropriate tool in every situation.
You know, we always use the Robin Hood example. You know, Robin, had a quiver full of arrows, and a trust is one of the arrows that we use. But an automatic assumption that avoiding probate is always better is not an arrow that we use, because you have to balance the benefits of each of these. You have to balance the risks. And in trust, the risks are interference with government benefits, almost a lock certainty.
Yeah, and that's the big cost, and that's the one that we want to avoid trouble with for most families.
Tom, as always, thanks for taking time to appear on the program.
You're welcome.
More from Contemporary Retirement after these messages.
Few things in life are as important as family. Leave your insurance orders to us, Wright Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
Every life that meets its end leaves a heart for love to mend. Sister, brother, family, friends are left to carry on. When the loss seems more than you can bear, it's nice to know that we'll be there at Douglas A. Fiery Funeral Home. We care.
Call Ed Lowe to help put your mind at ease.
Welcome to special guest feature on Contemporary Retirement. This segment focuses on various issues which are of importance to the retirement community. With me today is Dan Sedden, president of the Hagerstown, Washington County Convention and Visitors Bureau. Welcome to the show, Dan.
Thank you. I'm glad to be here.
That's quite a mouthful of a title.
Yeah, we shortened it to Visit Hagerstown. We operate under that. It's more memorable. It's easier to use in promotions and advertising. So Visit Hagerstown is a way to find us.
So that would be the way you do it on a Google search.
Absolutely. Yeah.
All right, now, while we're talking about the Washington County version of this, the fact is everybody in our viewing areas probably has a county that has a similar style organization.
Yeah, they all do, and some are larger than others. We both compete and cooperate with them. But to find yours, just put the word visit in front of your county name and put it in a Google search, and you'll get the right entity.
And one of the interesting things, you compete and cooperate, I think is very important, because when you look at some of the major draws in this region, like the Civil War, which is a great, it's across county lines, state lines here, and yet you're all really going at the same population, and many times people come here, they'll actually go to multiple sites.
Correct, and if you think about it, Harper's Ferry, Gettysburg, and Antietam are three of the biggest, most popular sites. So if we're going to bring a visitor into this region, we're going to share them across those three counties.
And everybody rises with the tide here, and so it's a central theme of tourism to get people to even think about it, why it's important, and so working together actually builds a better brand for everybody.
Absolutely does. A good example is there's a large convention in Baltimore this summer, and it's people who plan travel for youth and for students, and we're cooperating with Gettysburg to bring many of these travel buyers out into our region. We couldn't afford it on our own, but when we teamed up with Gettysburg, it made it very possible. and we'll share those visitors, and if we're lucky, we'll sign hundreds of bus trips into our region.
And then, of course, you get the Quad Straits area here. You know, within 30 miles, you're in 4 different states, and are all buying services and products, no matter where they're staying anyway.
Yeah, we live in a section of the Mid-Atlantic where if you are very conscious of state boundaries and county boundaries, you're limiting yourself terribly.
And so you work in that end. Now, are you a government agency or a private agency?
We're a private corporation. Our funding comes through a lodging tax, and we're run by a board of directors that's made up of people who are professionals in the travel and tourism industry.
And so it's to promote that. And so how's the funding achieved?
So if you're a visitor from out of town, you pay a fee to stay in a hotel. There's a 6% tax on top of that. Half of that goes to the Convention and Visitors Bureau. The other half goes to Washington County Commissioners, and they use it as an economic development fund.
All right, and so when you receive that funding, then your board sits and goes to work on trying to figure out how to maximize the benefit to the community by the use of those resources.
Right, we do promotions and advertising, and we engage in direct sales. We're doing anything we can to attract more visitors to our county.
You also have some tools to provide information. So I asked Director Greg to pull up the slides here, and let's take a look at what we got here. So what is this?
This is our visitor guide. It's our biggest print piece of the year. We published 100,000 of these for distribution. This year's theme, 2018 theme, is the arts. And that's the mural of unusual size on Hagerstown's brand new cultural trail.
All right, and so you'll be talking then about some of the museums and and the arts that are available, and people
Absolutely.
are surprised there's an awful lot around here.
Yeah, there is more than you can take in sometimes. We also have this calendar of events we produce 3 times a year, so if you're ever at a loss of something to do, this will absolutely offer you plenty. If you're bringing relatives in from out of town, pick one of these up and look at it, because there's just so much more going on in the county than you might realize.
Well, I didn't pick it up at the grocery store or your other distribution, so how might I also find out about it?
It's online, and if you just go to visithagerstown.com, you'll see all these publications, and you'll get access to our mobile app. So if you like to put all this on your iPhone, you can go to our visithagerstown.com website, and that'll connect you to the mobile app through there.
So what this really gives you the opportunity is to sit there one evening saying, I'd like to go to dinner, I'm tired of going to the same old places. You pull that up, and it's going to find you some dinner places, and ironically, not alphabetical.
Correct. Wherever you are in the county, if you search for shopping or dining, it's going to know where you are, and it's going to tell you the closest restaurant to where you're standing. That way it's not a stale alphabetical listing, and you're more likely to try something new because it's making a suggestion for you.
And then also, you didn't have one of these paper ones, but if you're saying, I got that family in, I want to show them something, just go on that site and it'll show you everything that's going on.
Absolutely, yeah.
Dan, I want to thank you for taking time to appear on our program.
Sure, my pleasure.
More from Contemporary Retirement after these messages.
Tranquility at Fredericktown Assisted Living and Memory Care provides a warm, home-like atmosphere that promotes daily life enrichment. At Tranquility, our medical director is a geriatric physician. Our professionals support and understand the various stages associated with Alzheimer's and dementia. We have on-site physical, occupational, and speech therapists, as well as around-the-clock licensed nurses. For more information, give Tranquility at Fredericktown a call today, because everyone deserves great care. Let us do the caregiving so you and your loved one can embrace life again.
Guys, I thought you were supposed to be working in the yard.
But Dad, just one more bid on HurleyAuctions.com.
If you haven't visited HurleyAuctions.com, you don't know what you're missing. Whether you're buying or selling, antique cars, tractors, boats, or real estate, you can do it all at HurleyAuctions.com.
Get to know Dr. Carrie Hesley at Diagnostic Imaging Services.
What I find most rewarding is caring for women through our Women's Imaging Center. We have a caring staff that will ease patients through an ultrasound, bone densitometry, breast biopsy, or mammogram. Our health team is sensitive to emotions involved in women's imaging and understands that every woman is at risk for breast cancer. Providing the community with a center that is so dedicated to breast health and the imaging needs of women is something special.
DIS Women's Imaging Center, providing women with progressive care.
Welcome to Contemporary Health Scene. Contemporary Health Scene focuses on the health issues affecting the retirement community. With me today is Rod MacRae, Information Officer, Washington County Health Department. Welcome to the show, Rod.
Thank you very much.
You know, Rod, the health department, with a few small exceptions, is really not a provider of medical services, although in the past you were a big force in the immunization and so forth.
Correct.
But your real job is educating and protecting the public.
That's very true. The shift, the focus has shifted in the last few years, especially with the advent of more universal health insurance. And we have always been a last resort provider, so now that we have more options available for the public, you're right, we're getting more into information and community-based health.
And there's been some very positive changes. And for instance, we now have the pharmacists and grocery stores routinely giving routine immunizations that does not force the family to go to their doctor's office to get it, or to kind of watch the calendar to find out when you're going to show up and do a group immunization.
Exactly. I sort of look at it as if we've succeeded ourselves out of the immunization business in that regard. You're thinking of flu vaccines.
In raising awareness of the public as
sure.
to what they need. Another one that is really very engaged with the retirement community is the shingles.
Yes, indeed. That's a very, very painful infection that people develop subsequent to having had chicken pox as a child, and it's can put you down for quite a bit.
And so there are vaccines out there. There are recommendations. I know that I got mine turning age 60, but now people are talking about even getting them earlier than that.
Yes, the recommendation that I've seen most recently is over the age of 50.
And once again, when I got mine, I just went to a local major pharmacy, told the pharmacist that I wanted that vaccination. And it was frozen. They said, well, you can actually have it, but just relax for a few minutes in our waiting room until we defrost it and we'll administer it. It was a very quick, painless process.
Didn't take any time at all, I'm sure. And probably didn't take you out of your normal routine.
No, I really didn't notice it at all. Mm-hmm. And so, so it's really, and that's part of the education awareness that you're trying to do through the health department.
Sure.
All right, one of our other great challenges is sort of this complete misunderstanding of flu. First of all, there's this perception it's just a bad cold.
Well, I would differ on that, but yes, some people do look at it that way.
Well, why is it different?
It's much more debilitating, and it's more likely to cause adverse effects in people who have underlying conditions that they may or may not know about. Colds are usually something that run their course in a few days. The flu can put you down for a week, a little more.
And one of the challenges that we have is the flu. They attempt the vaccine. It does involve some educated guesses to try to attempt to determine what flu vaccines are likely to cross the country in the beginning of the flu season. And they're actually in China right now trying to determine what they are predicting, but it's not 100% science.
No, well, as you say, educated guesses by very educated people, and sometimes they get it really right on target. Other times there may be a strain circulating that they didn't account for, but even if that's the case, if you get the vaccination, you'll still feel better if you get infected with the other strain.
And oftentimes, even if it's not a perfect vaccination, we've seen that a couple times in the last few years, it still reduced the impact of it because it was closer to what the body actually was infected with. The body responded faster and was able to deal with it more quickly.
Exactly so. And even with the hit or miss nature of it sometimes, it's still the best protection people can get.
And one of the great things is, so you have a tough year like we did this year, people think, well, I don't need to take it because it didn't work anyway.
Well, that's a mistake, in my opinion. I think that every year it's different. Every year the strains are different. It's a virus that mutates fairly frequently, and you're better safe than sorry.
And that's the great challenge is that sometimes people say, well, it's just not that big a deal anymore. And there's no question that the education has reduced some of the potential adverse impact, but the disease, if it's you, is still very dangerous.
Well, it kills, and people don't realize this, but nationwide every year it kills about 20,000 people or more.
And typically it's going to be older folks with compromised immune systems, or perhaps younger people, or perhaps some people that have some autoimmune diseases that,
sure.
It's critical that you sort of cut this thing off. And part of what immunization does, it sort of cuts the transmittal lines.
Sure, it does. It does. And it prevents, even if you're not at risk yourself, you should consider those around you, the elderly, the relatives and friends you come into contact with.
And of course, do you get the flu from the flu vaccine?
That has been said, I hear it every year. It's not true. I think sometimes what happens is it takes a week or two for the immune response to build in the individual. If you've been infected before but were asymptomatic when you got your vaccination, that's what happened.
Rod, as always, thanks for taking time to appear on our program.
Oh, it's always a pleasure. Thank you.
More from Contemporary Retirement after these messages.
The Community Foundation, through its scholarship programs and through its strategic grants, has been a positive influence for change.
Last year, change in Frederick County was influenced thanks to nearly 1,800 caring donors. Everyone can help. Your influence is key.
Help us proactively focus on where we need to be investing our energy in the future.
Albright, Crumbacher, Mal & Eitel are a full-service firm that provides elder care services including managing incoming bills, bill payment, depositing checks, balancing bank statements, and preparing, planning, and filing personal tax returns. Put your mind at ease and call us today.
Welcome to the Making Sense feature on Contemporary Retirement. This segment focuses on various financial issues which are of importance to the retirement community. With me today is Christian Wright, President of Wright Gardner Insurance. Welcome to the show, Christian.
Thanks, Michael.
Christian, we were talking last week a little bit about independent agents, and I'd like you to kind of give us a quick, differentiation between an independent agent, what's commonly referred to as a captive agent.
Yeah, so an independent agent is independent in regards to the insurance companies that they represent, okay? So the policies that they can sell representing several different insurance companies. A captive agent is one that is captive to one insurance company. We see them around.
A lot of the big names are captive agents.
Exactly, exactly.
And we see a lot of issues associated, particularly when we're dealing in the four-state area here, because we have people that own properties just across the river and so forth. And the nature of captive agents is that they're stuck only being able to mostly sell in one geographic area. And so you may have two properties 5 miles apart, but you can't use the same contract to insure them.
Right, right. The insurance carriers, the captive insurance carriers that captive agent represents, they do a great job of protecting by territory other captive agents. So in a place like our viewing area, yeah, I mean, if you have a place on the West Virginia side of the river and you have a home in Washington County and you're with a captive agent, you may not be able to have the same captive agent write that other property, and that can be confusing and a whole lot of other issues.
Well, then we have the issue here where we have the snowbirds, because oftentimes you cannot write through a captive carrier Florida properties.
Yes, Florida has its own issues with wind and wind and water and flood and all of that. So yeah, a lot of captive carriers don't write there. In fact, to be honest with you, the names of insurance companies that write in Florida changes almost daily. So if you are a snowbird, that's one of those opportunities that you really should be speaking with an independent agent about.
And one of the interesting things about this, there's a cost. Every time there's a policy written, there's an internal administrative cost. So when you have properties across state lines, you end up with 2 homeowners policies, sometimes 2 umbrella policies. You end up with additional costs that is structurally built into it. It's inefficient.
It is. It's very inefficient from a premium standpoint. You're going to be paying more by doing that. And then obviously the coverage issue. I mean, you may not be able to have an umbrella policy cover over both locations, and then you got to buy 2, or you go without, and then something happens, and it's just a mess.
And one of the interesting things is the captive business. It's an understandable business model. It's the lowest common denominator. It's designed to be efficient. There's really no customization of coverage other than putting some numbers on it, but they don't change their policies.
They don't. And in fact, the captive agents, technically they're actually employed by the captive insurance carrier, right?
An independent agent is not.
And an independent agent is not. So an independent agent is actually, it's their business. They can structure the policies as they wish. They'll go out and find an insurance company if they need a special insurance company to cover a special exposure, and there's no negative consequences for that. There's not a barrier to success with the independent agent. And unfortunately, with a captive agent, you have to fit in this box.
And there are plenty of instances where that's okay, but there's also many instances that as soon as you're off the beaten track, you start getting inefficiencies, you get gaps in coverage. And one of the things that I do not like to do is allow two different carriers to be insuring a similar risk, because they start pointing fingers at each other as to who's responsible.
Yeah, when you have a loss, they're like this, not ours, and that's not a good place to be if you're a policyholder.
And the fact is, you know, let's face it, the insurance industry has a great deal of resources. They're in the litigation business all the time. Doesn't intimidate them one little bit, but you as a consumer might find yourself really overwhelmed by the process.
Absolutely. You know, lawsuits happen daily and you know, by the minute with insurance companies. They're not afraid. But as a policyholder, you want to be paid and you want to get back to where you were before the loss or be protected.
And one of the interesting things about this is the insurance industry is a risk management industry. And the fact is, once you get away from the captive carriers, there are companies out there that will literally insure any risk. It's just a matter of premium.
Exactly. And that's why I enjoy being an independent agent, is because it's problem solving and I'm not limited. I will find the solution. I will create the solution.
And there are companies out there that have built their business around, you know, underwriting unusual risks. It's it's not difficult for them to do it. They understand the risk, and so something as simple as insuring both a Florida property and a Maryland property, they're putting them under a single umbrella. We got companies out there that will do it, even though a captive may not do it.
Absolutely, and that's yeah. I mean that's actually not unusual for us to be able to take care of clients like that, but it can be a challenge for that direct captive agent.
Christian, as always, thanks for taking time to appear on the program.
Thanks, Michael.
Thank you from Contemporary Retirement.
Remember a more carefree time? Leave your insurance worries to us, Wright Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
These days, it seems like everything's online, and filling out claim forms and receiving and paying bills online isn't always easiest. That's why we at Quality First Insurance encourage you to just give us a call. Let us help.
Hi there, I'm Paul Sweeney with Quality First Insurance, and it's still just as simple. Our offices are open every weekday where you'll be able to call and speak to real, live people.
No detail was missed. I'm so glad that I turned to Quality First Insurance.
I've recommended Quality First Insurance to my friends who've been just as satisfied.
If you're not happy with what you're paying for Medigap, or more importantly, not happy with your service, give us a try. We're locally owned, and we take the time to provide you with the best. We are Quality First Insurance, and our mission is to provide quality products to quality people. Pick up the phone and give us a call today at 800-745-1411.